Tell me a bit about some of the successes you guys have had. What's like the biggest project or the coolest project or the largest impact? Are there any like star children you can point to that just knocked it out of the park or were really noteworthy?
Yeah, it's hard to pick one. Like this is my success, but I'll give you a category probably, and I'll give you maybe a couple examples in that category. I'm a big fan of moving innovation upstream. So anything that involves early detection, anything that involves labor enhancing or labor conserving technologies that make the healthcare providers life easier, and also being able to see more patients as a result of that technology is a winner for me. Like that's something, and also that helps support patient-centered care that meets the needs of the patient. So those that live in rural, remote parts of the province can equally access in the health system we so desire. So that's the category that I'm very I like a great deal. I guess in that category, I would say that Nanostics, for example, with Clarity DX, we were a longtime supporter of Nanostics, the company, and they created Clarity DX, which allowed for a simple blood test to get an accurate diagnosis of prostate cancer, which helps with early detection of prostate cancer, because the sooner you detect cancer, the better your probability of a good outcome in that space. But it also involves a lot of reduction in biopsies, saving the health system money, right, in terms of that activity. So we were able to help them since 2013. We're not the only ones, but both our entrepreneurial ecosystem team and our health team work with Nanostics and Dr. John Lewis, in helping him develop that Clarity DX test. And that's now been accepted in Alberta. Last year we were at BioAlberta's 25th anniversary, and they announced the successful adding that to the formulary for Alberta to offer it to citizens. So it's a great example of a great test. I would say the other one would be WaveView Imaging. They just won the Pfizer Innovation Award. A really cool technology around a safe, portable, pain-free breast imaging using low power microwaves. And the cool thing about WaveView Imaging again is early detection in cancer, the ability to do so in rural remote areas, so you don't have to have a big diagnostic machine. And probably the last one, Jordan, I'll just mention this because it was at the announcement yesterday from our Accelerate Innovations into Care Concepts program. But Dr. Hadranathan from the University of Alberta developed a ultrasound you can do on your iPhone, right? So it allows, but it uses artificial intelligence to do remote imaging of your arm, for example. Say you're at a ski resort, you fall in your arm, you want to know if it's broken. This can literally be done remotely to tell you whether you need to go to the ER to have you did break your arm or you didn't break your arm, or you might want to have it further investigated. So the example they used in the demo yesterday was if you're in the ER and you don't want to wait 6 hours to get your arm looked at, they could possibly do this quickly and then decide, well, you didn't break your arm, you just sprained it. You can probably go away and come back, see your GP in the next few days. You're going to be fine. And they use artificial intelligence to help with the ultrasound to make that diagnosis. So I thought that was
Super
just
cool.
really cool. And all that cool tech that really enables, again, both the patient orientation is really cool because it thinks about the pain points in our healthcare system today, whether it be the emergency room or whether it be the long waits or whether it be the, just in Clarity DX, the unknown, right? The stress of not knowing whether you have prostate cancer. So those are great innovations, I think, that show that upstream early detection, early recognition, being able to help avoid, make the health system work smoother and also help patients get a better outcome.
Yeah, no, that's incredible. Especially like you mentioned, the upstream value, right? An ounce of prevention's worth a pound of cure when it comes to dealing with healthcare, and especially those early diagnoses, right? That can make all the difference in the outcomes. That's amazing. What about AI? You mentioned a little bit about that. Is that becoming a trend in the industry? Is just AI popping off in terms of the actual innovations coming to light and applying for funding?
Yeah, I'm absolutely convinced, Jordan, that advanced data analytics and artificial intelligence, machine learning are going to transform healthcare, right? So many of our proposals are are incorporating, like I just mentioned, Dr. Haren Anathi's portable AI ultrasound imaging technique, right? So that was using artificial intelligence in that space. We have an artificial intelligence enabling better health call in the field right now. We've had over 64 applications come into that particular call. We'll be soon be announcing the successful applicants in that space. But it just shows the importance of artificial intelligence and reinforcement learning, of which Alberta is a world leader. We're top 3 in the world for reinforcement learning over at the Alberta Machine Intelligence Institute, and that application to healthcare is going to be a game changer. We know that then the algorithms are only as good as the data that's fed to the algorithms. So we know that artificial intelligence needs vast quantities of high quality data to ensure a good prediction, good outcome. So we're working with government, working with different providers to help enable that access and data scientists. So I think it's a huge area. It's just only going to grow. The market cap depends. Compound annual growth rate. I've seen it as high as $27 trillion coming forward in the next few years, right? So we've got a huge market opportunity. We have a comparative advantage compared to other jurisdictions in Canada and in the world. And so we have to leverage, I think, that advantage here in Alberta.
Is there anything specific that you're really looking forward to the most in terms of healthcare or in terms of the innovation space? Any particular domains that you think are really going to be popping off or making an impact over the coming decades?
Well, we just mentioned a really important one, artificial intelligence and machine learning applied to the problems in healthcare. I think that's absolutely key. One of the things that I'm seeing, Jordan, and we're seeing over and over again is the health human resource crisis that Canada's in. So we have the World Health Organization predicts that the world will be 18 million health practitioners short by 2030. So that's in 6 short years, we'll be 18 million health practitioners short. So what we're looking to emphasize then in the context of that is innovations, as I said before, Jordan, that enhance the productivity of the labor of physicians and nurse practitioners and nurses to be able to do more with the same or do more with less, so they can see more patients in their days in the activity. Or we want technologies that conserve their time so they can spend more time interfacing with the patients to help support them in their care journey. So we really want to prioritize that across the domains of primary care, acute care, continuing care, and also mental health and addictions. So those are the 2 things I think are really starting to collide. One of the things that's clear is that even if we have access to data, sometimes we don't have we don't have the skill sets to use the data. So we have to work on developing analytic skills within our professions, within our domains. I know a lot of people were trained to be physicians or nurses or dietitians or occupational therapists, but they weren't trained to be data scientists and data analysts. So we have to work as a team and our interdisciplinary team to move that forward into the next phase.
I'm Dr. Jordan Vollrath, and you've been watching Cherry Live, brought to you by Cherry Health. Please like and subscribe to see more clips like this, or check us out at www.cherry.health, Canada's medical network.